Hi everyone, my name is Andria Burke and I am the Executive Director of the Society of Graduate Professional Students, otherwise known as the SGPS, here at Queen's University. If you are a graduate, law, consecutive education student, or an undergraduate medical student, the SGPS is your student society. Your elected executive team and the staff at the SGPS work for you. Your SGPS represents and advocates for you across the university on issues crucial to the well-being and success of graduate professional students. In response to the needs and concerns of our members, we also run several services, including the Peer Academic Advisors Program, the Graduate Peer Support Center, your health and dental plan, and much more. Today we are here to talk about your health and dental plan. This session discusses what's covered in your mandatory primary health insurance plan, UHIP for international students, versus your supplemental health and dental insurance plan through the SGPS for graduate and professional students. This is a summary of what it means to you and your family. This is an infographic of the various types of insurance that make up your health and dental coverage as a graduate or professional student at Queen's University. Your primary coverage takes care of things like visits to your family doctor, a walk-in clinic, or the hospital. It also assists with the costs associated with x-rays, lab tests, pregnancy, surgery, or visits to the psychiatrist. Your supplemental coverage assists with the costs associated with prescription drugs, dental care, eyeglasses, health practitioners like chiropractors or mental health therapists, and much more. You must have primary health coverage either through OHIP or your provincial equivalent, or if you're an international student, UHIP, in order to access the SGPS health and dental plan. In order to enroll your dependents onto the plan, your dependents must also have primary health coverage in order to access the SGPS health and dental plan. I am only going to speak briefly about primary coverage as other bodies, namely your province if you are a domestic student, or Queen's UHIP administrator if you are an international student, can provide information about your primary coverage. If you are a domestic student, chances are you have already enrolled in your provincial coverage, so I'm not going to speak about it today, but I am going to briefly touch on UHIP. International students are automatically enrolled in UHIP, and any dependents of international students must be manually added to the coverage within the first 30 days of being within Canada, or a late enrollment penalty and retroactive UHIP fees will apply. Canadians who are returning to Canada after being outside the country for a substantial amount of time, or new permanent residents, are eligible for short-term UHIP, which provides up to 3 months of coverage, while awaiting the start of OHIP. Please check with Service Ontario or your provincial equivalent to make sure that you require interim coverage through UHIP. UHIP is mandatory for international students and their dependents. Opting out is permitted under very limited circumstances. To inquire as to what those circumstances are, you are going to have to contact Queen's UHIP administrator at uhip@queensu.ca. If eligible for an exemption, opting out must be pursued through the UHIP portal within the first 45 days of the academic term only, or the costs associated with UHIP are non-refundable. Proof of your alternate coverage will be required, so make sure you have that ready when you go to the UHIP portal to begin the exemption process. Please note, the SGPS does not deal with UHIP enrollment, exemptions, or claims. The entire UHIP process is done through Queen's UHIP administrator at the Queen's University International Center, otherwise known as QUIC. To learn more about UHIP, check out QUIC's website. The URL for it is on your screen right now, or email uhip@queensu.ca. Now that we better understand what we have to do to secure primary coverage, let's move on to our supplementary plan coverage, which for graduate and professional students at Queen's is the SGPS Health and Dental Plan. The SGPS Health and Dental Plan involves 3 different companies working together for you to provide you with the best supplemental care possible. The SGPS is the plan sponsor, Student Care is the plan provider, and the insurance company is Sun Life. Both the SGPS and Student Care work directly with you to help you make the most of your plan. It is very important to remember that both yourself and any dependents you have must have primary health coverage, either your provincial coverage or UHIP, in order to be on the SGPS health and dental plan. This is so you can have the most complete care possible. Your supplemental plan will not pay for you to see a doctor, nor will your primary plan pay for any medication. You must have both to get the best coverage. Students who are registered as full-time on-campus students in an eligible graduate or professional program are automatically enrolled in the SGPS Health and Dental Plan. Students who are not automatically assessed the fee can contact Health Dental at sgps.ca in order to discuss coverage. To see if you have been assessed, check out your printable fee statement on SOLIS. If you have a charge labeled SGPS Health and Dental Plan, you have been assessed the fee. Instructions on how to find your printable fee statement can be found at the URL on your screen right now. If you have any questions about the fees you have been assessed, please contact SOLIS at queensu.ca. Students who have paid for the SGPS Health and Dental Plan, whether it be those who were automatically assessed or those who have opted in, may also opt in their dependents. Details and dependent enrollment instructions can be found at www.studentcare.ca. Please note, if you have to enroll yourself or your dependents into the SGPS Health and Dental Plan, you can only do so from September 8th, 2020 until September 30th, 2020. Late enrollments are not accepted. If you are registered as a full-time on-campus student, you are automatically assessed the fee for the SGPS Health and Dental Plan. The $610 fee can be found on your SOLIS account as SGPS Health and Dental Plan. The dependent rates will be available on www.studentcare.ca in the coming weeks. Students with their own coverage through parents, employer, partner, First Nations, etc., can opt out of the SGPS Health and Dental Plan by uploading proof of their alternate health and dental coverage during the enrollment period at www.studentcare.ca. Please note that UHIP or OHIP are not eligible to be used to opt out of the SGPS Health and Dental Plan. UHIP or OHIP is your primary plan and does not cover you for the benefits offered by the SGPS Health and Dental Plan. If you are able to opt yourself out of the SGPS Health and Dental Plan, you can only do so from September 8th, 2020 until September 30th, 2020. Late opt-outs are not accepted. As mentioned previously, the SGPS plan covers many things that are not covered by your primary plan. Prescription drug coverage includes drugs that are prescribed by your doctor and fulfilled by a pharmacist. Over-the-counter medications, which are medications you buy without a prescription, are not covered. Extended health coverage includes practitioners like physiotherapists, chiropractors, speech therapists, dietitians, athletic therapists, occupational therapists, registered massage therapists, psychologists, and social workers. It also includes coverage for medical equipment and supplies, ambulance transportation, and orthotic appliances. Vision coverage extends to eye examinations, eyeglass frames and lenses, as well as contact lenses. Dental coverage includes coverage for oral examinations, including limited and recall examinations, radiographs, preventative services like polishing and scaling, minor restorative procedures like fillings, extractions of teeth, and anesthesia. It is strongly recommended that you obtain a pre-authorization for extensive dental procedures to prevent an unexpected financial shock. Your SGPS Health and Dental Plan also includes travel coverage, but during this COVID-19 pandemic, that coverage may be considered null and void. To learn more about your coverage, including how the COVID-19 pandemic is affecting your travel coverage through the SGPS plan, check out www.studentcare.ca. If you ever have any questions or concerns regarding your SGPS Health and Dental Plan coverage, you can contact Student Care by phone at 1-833-851-1362 or visit their website at www.studentcare.ca, or you can email me directly at healthdental@sgps.ca. I hope that has helped to explain the difference between primary and supplementary health care, as well as the benefits involved in both categories. If you have any further questions, or you just want to learn more about the Queen's University International Center or the SGPS, check out the additional resources listed on this slide. Thank you so much for your time, and I hope you have a great day.